Okay, great. Can you hear me? Good. So it's wonderful to be here. I am going to be going through a lot of slides, but because I have a lot I want to share with you. But if I go too fast, you can just see a lot more of this when my book comes out in January, because I actually talk about it a lot more there. So let's begin. So this is a quote I really like, and I think it's important to internalize it, and hopefully it will become very clear why I'm bringing this up in a few seconds. But you know, when we try to pick out anything by itself, we find it hitched to everything else in the universe. And I want just for a minute for everyone to close their eyes and imagine what a healthy child looks like. So just take a second to do that. Okay, so open your eyes and tell me, just call out a couple things that you saw. How did you identify that was a healthy child? Straight posture, smiling, happy. Okay, joy, jumping, bright eyes. Okay, so I bring that up because I think that we see so many sick people and sick kids that we don't actually always know what health looks like, you know? And I just have asked a lot of people, what is health? What does health look like to you? And the answers are like pretty surprising because I don't think a lot of people do know what it looks like. And so health is not only the absence of disease, and it's not just about whether we're showing symptoms. Actually, I don't think either. And it's not simply about lab results. Like I've been to pediatricians, you know, giving this kind of talk, and they say, good BMI or growing on the curve or, you know, good CBC or, you know, like that is not, I mean, those are reflective sometimes of health, but there's something more going on, right? So, I have to point it in the right place. Okay. So health is the relationship between the internal and the external terrain, okay? And I think that health manifests as resilience, okay? So I actually think that resilience is the ability to bounce back. So stressors are inevitable. Like kids are not always going to be smiling, and I don't even think they're supposed to always be smiling, okay? Stressors are actually necessary to build resilience. And we know that chronic diseases are rising in children. I don't actually need to go into the details and the diseases, okay? But I think chronic disease is actually a reflection of lack of resilience. So there's actually some science behind this. It's not just something I'm making up. Bob Navio's great work on the cell danger response. And the cell danger response basically says that there's this evolutionarily designed metabolic response that protects cells and hosts from harm when there's a stressor. And what happens is that there are these encounters that are threats, and they stress our homeostasis, our ability to maintain homeostasis. And then after the danger's been eliminated or neutralized, then there's all these anti-inflammatory processes that happen and kind of get things back the way they should be and reverse that process. But sometimes it persists abnormally, and then it affects gut microbiome and metabolism, and it disrupts all the body organ systems. So these are slides from Russ Blaylock, who has done some really amazing work in this area in the brain. And so this is an example, basically, in microglia of the cell danger response. And microglia are kind of immune cells in the brain, but actually more than that. They're kind of nurse cells. And they are in a 3-to-1 ratio with neurons. So they're really busy doing things to nourish and take care of neurons. But when they get activated by whatever stressor may come along, there's these cytokines and chemokines that are released, and it causes this whole excitotoxin cascade, okay? And the cascade basically produces free radicals, mitochondrial dysfunction, and immunoexcitotoxicity. So this is basically what the cell danger response looks like in the brain. And we know that that microglial activation is connected very deeply to every neurodegenerative disorder that's in existence at this point, and autism and Tourette's and ADD and Alzheimer's and Parkinson's and on and on and on. And so then the microglia can switch back to reparative mode, and they release BDNF, brain-derived neurotrophic factor, and nice growth factors, and anti-inflammatory cytokines, and everything is nice and happy, and the neurons repair. Okay, so let's talk for a second about terrain. What does terrain look like in children now? So we have a lot of things that are challenging and different from how they were. You know, we've got different flora in the parents. We have more C-sections rather than vaginal birth, formula feeding versus breastfeeding. And I mean, each of these topics there could be a whole talk about it, right? Chronic use of antibiotics, steroids, all these vaccines, lots of pharmaceuticals, processed food, and a lot of time indoors. And so our current health paradigm is that, okay? We're afraid of everything. We're afraid of antibiotics. We're afraid of germs. We're afraid of sun. We're afraid of dirt. We're afraid of, like someone once, I put a slide of nature up, and someone after the talk said how upset they were that I put this slide about nature because they got Lyme disease when they were out in nature, so they don't think you're supposed to be in nature, and it was like really upsetting to them. Okay. One day. Okay. So where did we get this idea of avoid, avoid, avoid? So our good friend Louis Pasteur, back in the day, basically said, okay, well, diseases are caused by these microscopic, invisible to us microorganisms, and they invade us, and they basically grow out of control and reproduce and kill us. Right? I mean, that's the germ theory. Okay? And it's not like totally off. I mean, we do know that that is an element of what happens. It's sort of that story of the elephant, right? Like the blind man and the elephant, and we're all touching, right? So there is that process that does happen sometimes. But there was another school of thought at the same time, Claude Bernard and others, who had this other idea of the cellular theory. And, we skipped there. Okay. So most microbial diseases are caused by organisms present in the body of a normal individual, and they become the cause of disease when a disturbance arises which upsets the equilibrium of the body. Okay. So I think of the germ theory as kind of a sitting duck theory, right? Like we're just sitting there, and basically anything could come your way and attack you and kill you, and there's nothing you could do about it. The cellular theory I think of as the terrain theory. Okay. And the terrain theory is who is the person who is the host of the organism and what's happening in that relationship. And the cellular theory kind of gives you an idea that maybe you actually could do something about what's happening in the body. Oh, I'm like not getting this so right. Okay. So our bodies actually crave complexity, and our immune systems are actually like not like these warriors that we thought, but kind of more meet and greet. Meet and greet, likes to meet lots of different organisms all the time, and learning and kind of developing that way. So I actually think this magic bullet model, like antibiotics, right, or vaccines, or any of these things are really outdated because really biodiversity is what we're learning is the new magic bullet, if there were one. So our paradigm is starting to change. We're using probiotics. We're using things like Saccharomyces boulardii, yeast. Yeast is helping, to get rid of things like C. diff, the microvirome and oncolytic viruses, which I'm going to talk about, and things like soil-based organisms and fecal transplants. Can you imagine 15, 20 years ago talking about infusing feces into people? I mean, but here it is, and it has good data. So we know that diverse microbes actually prevent atopic disease. And, so there's a study that we all know about the hygiene hypothesis, right? And there's this study that basically said kids on farms are less likely to have atopy, asthma, and so on. So we thought, okay, well, that's probably because in urban areas there's just not so much microbes, right? So then that's probably what it is. But someone actually said, well, let's actually examine that. So they did, and it turned out, no, there were the same number of microbes, more or less. The difference was the diversity. So on a farm, there were many, 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 many more organisms, whereas urban, many fewer, a very narrow array. And that actually is what they felt made the difference. So now we're also starting to understand how, atopic disease and asthma and all these kind of allergic and autoimmune responses are really being driven by the gut and being driven by flora. And although we're talking about the gut microbiome, I want to just kind of remind everybody that we have a lot of microbiomes in our body. I think the skin microbiome is something we ignore a lot, and I think, that's probably related to vitamin D issues, how we absorb vitamin D, and I think there's a lot that could be said about our total microbiome. Even the placenta has a microbiome, which we used to think was sterile. So there's a lot of microbiomes to think about, but we are all into the gut right now, so that's where we'll go. And, we're learning basically, again, that like babies with certain kinds of flora and more narrow flora are more likely to develop asthma later. And we're learning about viruses having a role as well. Look at that, because we thought viruses were terrible things which we need to avoid at all costs, right? That's like our whole kind of vaccination philosophy is viruses kill. So it turns out maybe that certain viruses may be really helpful. And actually, in this particular study, which was in Nature at the end of last year, this murine norovirus, when introduced into the gut of germ-free mice, actually took over for the microbiome of bacteria and without a blip, okay? There were no problems. The gut wall was healthy. Everything worked as it was supposed to because of murine norovirus. And this is preliminary and early, but it's very impressive. I really think this is a landmark paper as far as understanding that the microbiome is a much more diverse community than we really like to consider or have considered. It turns out also that some of these viruses may protect us from cancer. So there's this whole different layer too, that people who have had mumps in childhood have half the risk of developing ovarian cancer later in life in a couple of studies, and that there are certain antigens that seem to trigger our immune systems to target cancer. And similarly, measles virus, which is now kind of the new darling as an oncolytic, is actually identifying and helping our immune systems to identify and attack tumor cells, which are high in CD46 receptors. And somehow, basically, as we're talking about, the avoid philosophy may not be as helpful, and kind of this meet and greet philosophy helps our immune system develop social skills and know who belongs and who doesn't in the body, how to take care of and maintain its terrain. Parasites, those bad, nasty, nasty worms, may actually have a role in protecting us against autoimmune conditions and metabolic conditions like type 1 and type 2 diabetes. So it turns out in this Aboriginal study, and there's actually several others, the people who had infection with these worms, essentially these parasites, had 60% less likelihood of having type 2 diabetes, even though type 2 diabetes is very, very broad, very, very common in this population. And actually, another study looked at type 1 diabetes and found that so our upper picture is where there's a lot of type 1 diabetes, and our lower picture is where the red is where there's a lot of endemic parasitic infection. So it's certainly interesting, okay? I don't think it's an answer. I don't think it's definite. I don't think we should all be going out and trying to ingest parasites at this particular point in time. But I also think we need to be really careful, because I know that a lot of people in integrative medicine, not just conventional medicine, are into this attack of, oh, this person has parasites, they have, overgrowth of this, and I'm not saying we don't have to address that and we don't have to treat it, but I think we need to start thinking in a more complex way. Even here in this paper also from late last year, we talked about, or here they talked about, the relationship between humans and nematodes of the digestive tract can be considered as a mutualism rather than a typical parasitism, okay? So this is really starting to come forth, that it has more to do with the person who has the disease than it has to do with the disease itself. And in this study, looking at gluten challenges and celiac, hookworm actually increased diversity of microbes. So no hookworm, hookworm. And all the little blue dots up at the top show there was richer biodiversity in the gut. So how can food reverse or prevent cell danger response? So food is the embodiment of our terrain. Okay? We eat animals and plants. Animals live on plants. Plants live on soil, sun, water, and rocks. And microbes and mycorrhizae and all these other complex organisms, including what we think of as pests, right, are basically facilitating nutrition for the plants and for us. Nutritional depletion makes us vulnerable to illness. We need reserve. And reserve is really nourishment. Okay? And nutrient density creates resilience. And I think nutrients include things like microbes and include things like dirt and soil. I think we have to really broaden our idea of what nutrients really are. So we need to think about the quality of our food and ask ourselves these questions. We need to think about what is nutrition. When we're eating plants, we're getting soil if we're eating the right kinds of plants from the right places. We're getting stem cells and pheromones and microbes and very diverse phytonutrients. Okay? It's not just about like protein and fat and, magnesium. And I'm not saying those, are not important. They're important, but they're not all it is. So geosmin is the odor produced by microbes in the soil as they break down plants. Who right now can imagine the smell of soil? Okay, go there for a second. That is geosmin. And basically, it's a smell of microbes. It's the cloud, it's the aura of microbes of soil, okay? And that's where we taste the flavor of life in beets and carrots and the terroir, the sourdough from France versus the sourdough from, San Francisco. And it turns out soil organisms actually make us happy. Okay, so there's a study looking at a certain strain of a soil bacteria, and it turned out when injected into cancer patients that they had improved symptoms and also improved emotional health, mood, cognition, and so on. And actually in another study, it showed that it lowered stress in an animal study. And in yet another study, when they put it on a little mini peanut butter jelly sandwich for the mice, so this time it wasn't injected, actually they navigated a difficult maze twice as fast and exhibited half of the anxiety behaviors. And we need constant exposure because the superhero effect, as they called it, lasted only 3 weeks. And then they just went back to being, Clark Kent. So eating organics is actually important because we don't want to be getting all the antibiotics and all the pesticides that are killing the microbiome. So we want to eat real food. And what is that? Fermented foods and taking care of your microbiome that way. Drinking raw milk, and actually, because people think that this is like a deadly weapon, I just included a couple, and that means, it's certified, state certified raw milk, perhaps, and make sure you tolerate the milk and all of this. But there are studies basically showing that in babies, so there's 2 studies, the Gabriela study and the pasture study, that showed that raw milk, when babies drank it, they had 30% fewer infections, they had fewer fevers, ear infections, and their CRP was lower than their counterparts. And in another study, showed fewer allergies and less asthma and hay fever. So that is the pasture study. That is the Gabriela study. No children were harmed in the making of these studies. Eat plants. I don't know why she's wearing gloves. I'm going to have to change that picture. Get those gloves off, kid. But when you're doing that, getting all those rich phytonutrients, getting soil and all of that. Raw honey, which I just love to kind of like flip everything on its head. So it turns out raw honey actually is being looked at as a treatment for type 1 diabetes. So for everyone who's like, no, we can't have sugar, we can't have any sweet, we can't. I'm not saying, guzzle raw honey, although I had a girl at my table today for lunch and she ate half of a jar of raw honey right in front of my face, which was, I was like, what's going on there? But in a study, actually, there are several studies, and so it's quite fascinating. In a study with metformin, metformin alone and metformin in raw honey, it turned out that blood glucose levels were much lower and insulin was better maintained with both the raw honey and the metformin together. So We really need to start, again, thinking differently. And honey is like very rich with pollen, it's rich with micronutrients, and it's also, it's also full of phytonutrients. Blackstrap molasses, it turns out a serving of blackstrap molasses is higher in antioxidants than blueberries, serving of blueberries. So everything's connected: soil health, plant health, animal health, all of them together. Dr. William Albrecht, who is this amazing soil scientist, had been looking at that for many years, has written many very interesting books about it. And he really charted it all out, that, when you have less soil fertility, you have sicker people. And I just want to bring in this idea of being afraid of outside, okay? Because it turns out that we really need light and sunshine in order to develop our eyes. There's this huge epidemic of myopia in Korea and in Asia, and 97% of young men are nearsighted. And they know this because there's only a certain number of eye doctors, and they can't manage all of these people. And it turns out, how many hours a day do you need to be outside in order to prevent this from happening, ideally? Guess. 3 hours. 3 hours a day, outdoors. Okay. Time in nature is actually incredibly healing. It enhances hospital patients looking out the window at trees. That's all, okay? More favorable recovery, lower hospital stays, lower complications, fewer negative comments, less analgesics, and so on. Reduces pain and anxiety in the dentist chair. If you have a picture of nature, I mean, we're not even talking about the microbiome here. We're talking about some much deeper connection. Children who play in highly natural school playgrounds have fewer attention and concentration problems and improved cognitive and physical functioning than those playing on less natural playgrounds. And that includes better executive functioning. And I don't know if anyone here treats children, but I know that so many kids are put on medication because of poor executive function. Throw those kids outside, for God's sake, because a few hours a day outside would probably get 75 or more percent of children off of their medication. And it enhances cognition. So there's this idea called Shinrinyoku, which is forest bathing. And it's practiced in Japan and in Asia, and they do a lot of research on basically this idea that natural killer cells are incredibly boosted, as well as anti-cancer proteins, and reducing cortisol and all kinds of amazing things that basically happen outside in the forest if you go and immerse yourself in the forest. So that is preventive medicine in Japan and the ocean. So dirt, eat it, grow food in it, bathe in it. Okay, when I wrote my book, The Dirt Cure, I really fought with the publisher about the title because they were disgusted. They told me they recoiled when they heard the word dirt. They said, "It sounds like you're going to tell children to eat dirt." And I was like, I am. So I think our choice is between this and this. Thank you.
Thanks so much for watching, and for more great clips like this, please subscribe to our YouTube channel. I've created a special free video just for you. It's called The 4 Top Productivity Tools for Practitioners. And it'll give you some starting points on how to save time in your practice so you can focus on what's most important to you in your business and life. All you have to do is click on the link below.